Hi, everyone. I'm Todd Keats from My Care Friends, along with Katie Seymour from My Care Friends and Dr. Michelle Koolaee. We're thrilled to welcome you back to Women and Rheumatic Health, Invisible Battles, our educational series providing help to both women and their caregivers, and quite frankly, anybody who has a loved one that is challenged with a rheumatic health issue. Today's topic is receiving a diagnosis, and that can bring relief, fear, confusion, validation, and sometimes all of those at once.
Thanks, Todd. We want to acknowledge all the caregivers and the loved ones listening here, and really emphasize that we actually just were talking about this. No two journeys look the same in terms of a diagnosis, and the emotional side is just important as the medical side. So thank you so much, Dr. Koolaee, for being here. We're really looking forward to hearing your tips on this important topic.
Thank you. Thank you for having me. And I think this topic is really important to talk about. Particularly, I think that when someone first gets a new diagnosis of a rheumatic disease, can be a lot of different emotions, and how does that look like as we get started out? It really is, there's a complexity to it, as we were discussing earlier. No two people are the same, and diseases in rheumatology can also be very, very different. And so, but things to really acknowledge, I do see patterns in what it looks like when someone first gets diagnosed. I think that definitely there can be feelings of relief because people oftentimes are navigating symptoms for a very long time, may not feel heard sometimes, may just be struggling with that, like know that they don't feel well, but they have relief of, oh my gosh, I have a diagnosis finally. So that can feel good, of course. But also I think it's layered. There's a complexity to it in that there can be feelings of uncertainty, having a rheumatic disease. There's different levels of uncertainty, not knowing what medication regimen they need to be on. How will their disease be? What will the future look like? Will their mobility be impacted? And just mentioning in this space that is normal. If you're feeling that, that's completely normal. It is hard. It's very, very hard. First having the diagnosis and recognizing that it's something that will be with you, and having to navigate through just not having like always the answers. It's normal to feel grief and different layers of grief. And I think that just, whatever one is feeling, and those emotions are very normal. Feeling anxious, feeling isolated, especially if the symptoms are invisible. And even, from time to time, I do hear people express anger and feeling that, gosh, I've had this for so long. Why did it take so long to get diagnosed? So I think definitely all of those different emotions are normal to see when first receiving a diagnosis.
Yeah, that's interesting. Why do women, so many women, and I've talked to many women about this, including my mom, say they felt dismissed before the diagnosis?
I think that the diagnosing rheumatic disease, a lot of it is pattern recognition of different data points. And some of those data points come from the lab testing and like inflammation markers or abnormal blood counts or something there. And but some of those other data points that may get overlooked or missed are things like pain or fatigue or just low-grade fevers or just symptoms that one might not readily kind of catch. And so it's easy to feel dismissed when you're kind of going through. I just saw someone this morning who's had episodes, a young lady with like episodes of debilitating fatigue. She's a grad student. I do believe that there's something autoimmune, but it's so easy to attribute, like in someone who's high functioning and who has stress, to say that, oh, that's just you're just anxious, you're just stressed. And people believe it, and so they get kind of gaslit. And it's anyone's fault. That sometimes that is the nature of the system, that when these appointments are 15 minutes and kind of have to assess really quickly. that can happen. So yes, I think that that is one circumstance where women can feel dismissed, and they don't have to.
Yeah, it's a great point. I'm smiling because I do that to myself all the time as a woman.
Mhm.
I gaslight my own self
Mhm.
when I'm not feeling well or when, when we're in that brain fog world, which is really common. And as we know, it's a hot topic right now with women and health and middle age and perimenopause and so on.
Mhm.
But back to romantic health, there's this emotional component as we kind of touched on earlier. From your perspective, what should women know emotionally in those first, even like few days or a few weeks after hearing their diagnosis? I think that's a really important and scary time.
Yeah, I think that emotional reactions are normal, and that whatever you're feeling, whether it's anger or grief or anxiety or whatever it may be, allow yourself to feel that. And that you don't, I actually feel, I believe that leaning into it and just letting yourself feel what you need to is a really healthy way to be. And as much as one may think, oh, I need to be positive and everything's okay and everything will be okay, I think that it's also really, really important to validate those feelings and like, hey, I'm really sorry. I'll just say this is really hard for you. What you're going through is incredibly difficult. And I make a point, and anyone that as I can recognize is going through something hard is to say that, because I think it can feel really really important. I just think it's important to validate.
Yeah, absolutely. And so much goes on after the diagnosis. And, so I think the next steps we want to talk about is we want to demystify those next steps. And I know there's a number of topics we have down to talk about that. And I think Katie can start off with a question.
What surprises patients most about the first few months after the diagnosis?
I think that again, everybody's different, but with rheumatic diseases, it's often okay, we're navigating and we want to treat chronic inflammation because that's sort of the crux of inflammatory joint pain or fatigue or other different symptoms, skin symptoms, etc. And I think that it's recognizing that, okay, we start with some treatments and we have to reassess everything. We have to be meeting at like scheduled intervals. And the drugs often take time to work. So we're kind of making a change. We study the body, study the labs, and it's like this continued sort of evolution. And one of my patients years ago said, "We're kind of doing a dance with the medication regimen," which I think is like the most concise, crisp way to explain it. That it's that like methotrexate may work for one person and work well, but then the next person might get side effects or get like hair thinning or fatigue or headaches, or it's kind of like you just have to get on the path and to kind of settle in with like knowing and trusting I have the right support, I have the right system. But there is a baseline of like uncertainty from the patient perspective when you're the person navigating through it, and just sort of trusting the process and knowing
Mm.
that like the you might not have like the exact answer. When will I be able to do, to be able to run or to be able to go on a
Right.
hike with my family? And like, I think that that is something important that people may not recognize at the get-go.
Yeah, that's a great one thing to just add, which I love. We've talked about this before, is treating based on obviously diagnosis and labs, but based on symptoms, which
Mhm.
is it's tricky from a woman perspective, or really anyone to kind of note that.
It is. I will say, like, I had an appointment this morning, and like this, our care model and this practice is allows for more time to be able to get to the depth of what's needed in the with
Yep.
symptoms. And I needed to understand her fatigue and talk about her fatigue for
Yeah.
15 minutes. And now I'm like, okay, I really got it. I really like, because
Yeah.
that's not something that I can sort of measure necessarily, but
Right.
I really needed to know that for her to be able to gauge her lab abnormalities, which were non-specific. How does that tie in with her symptoms? So I think that it is really needing time.
That leads to my question, which I'm going to use the word typical. and I know there's definitely very little typical when it comes to this. How long does it typically take to find the right treatment plan? And I know that can be all over the board.
Yeah, I would say it is definitely that. I always have to emphasize no two people are the same. No two even diseases can vary. Some people are really, really mild, some people are very, very sick. But I think definitely from getting the diagnosis, I think the first year is sort of the bumpiest. And I think that there's a lot to adjust to. But usually after like within the first year, we have some sense of, all right, like we know what's working, we know what works for your flares, for mild flares, for severe flares, if you have them, which again, some people don't. People are kind of settling into and at peace with and accepting sort of the mindset shifts that are needed in order to have a chronic rheumatic disease. And they kind of get their support systems. They know, they understand rheumatology. They understand how their rheumatologist might be thinking. And for some people, it is like they have to really kind of go through it. And so I would say definitely after the first year, there's definitely a tremendous amount of progress in many different ways, just being a patient for people that are really committed, they're on board. But to recognize that it is bumpy the first, I would say 6 to 12 months.
I want to
Yeah.
follow up with something. Sorry, Katie.
No
I
worries. No, go ahead.
want to follow up with something because as much as you are the physician who is helping them understand labs and symptoms and a plan, a treatment plan,
Mhm.
you're also a counselor. You're
Mm,
also there to help them, especially during that bumpy time,
Mhm.
because human nature is like, wait a second, this isn't working, or is this working, or how are we going, and so forth.
Mhm.
How do you deal with that? How do you find that? Is there, and I would imagine everybody's different because we're all human beings, but do you have a certain philosophy?
I truthfully feel, I think it's through my own personal experience, having a child with a chronic disease that has a lot of uncertainty. I think it really allows me to understand more deeply what individuals with chronic diseases go through and the
mm,
level of uncertainty that people
mm,
have to live with. All of us have uncertainty just as we naturally mature. We navigate through life. But I think it's really a different level, like navigating through that as with a chronic rheumatic disease. And so I really just sort of put myself in their shoes, and I feel like I do have a unique life experience, which allows me to have that level of insight. And so I think that, and I do believe in order to navigate through having a chronic rheumatic disease, it is a tremendous amount of mindset shift that's needed. And so, and just kind of staying mentally well. I think that the mind needs to be healthy, and if the mind is healthy, then the body, we could take care of our bodies. And so that is why I address it, and that's why I think it's particularly important in women with rheumatic diseases.
mm,
Yeah, and I think that's probably particularly helpful because it's a tough road. Right? I
mm.
witness it all the time with my mom. It is a tough road, and it can't be underestimated. So it's a lot of navigating. Navigating, is an overused word, but it's an appropriate word.
Well,
Yeah.
and I think also just accepting that and like getting to a point when, as the patient with navigating through that, you're able to say, I'm doing enough. I'm doing a great job. I
Yeah.
have a great support system. This disease sometimes I don't have control over, even if I'm doing my best. But I know that, I can always control myself and how I choose to be. There's a lot that one can control
Mm,
even with a disease that is that can be feel like one, that things are uncontrolled. But if you're able to control the controllables, then you're at least, as proactive as one can be. And so then, if things are, when they're difficult, but then it allows you to sort of appreciate when you're able to go on that walk, when you're
Mm,
able to participate, whatever small things that were difficult to do, but you're able to do, you have more gratitude and like are able to find these pockets of happiness
mm,
that you weren't able to find before.
mm. As I'm listening to you talk, it really does sound like from your perspective and as a provider, you are giving your patients permission to feel the things that are uncomfortable and
Mhm.
permission to advocate for themselves, and you're, with them along that
Mhm.
step, which is so wonderful. Which kind of, I guess, brings us to sort of the next topic, looking at this and, the individual,
Mhm.
invisible nature of this disease.
Yeah.
What does it look like in helping, how do you explain the illness to others as a patient? And, how do you, advocate in that way too? That's tricky.
I think that this is a big topic, and I will, in summarizing, a very important item that you bring up is that it's not your job to explain things to
Mm,
everybody because
yeah.
it's impossible for everybody to understand. The people that love you, that care about you, that support you, they will be there no matter what, even if it's like they don't know how to help or they're just there, just being there. And I think that, you will, and sometimes we talked about in like a previous episode, kind of these invisible boundaries sometimes
Yeah.
that we need
Yes.
to create, which I thought was a really powerful statement and really appropriate that
Hmm.
sometimes as we're creating our circle of support and one that has someone that has chronic rheumatic disease, you include the people that care about that you, that love you, that support you, and it's
Yeah.
not your job to try and convince or explain to others. And
Yeah.
just, hey, I'm not feeling well. Sorry, I'm canceling last minute. I would love to be there. And that's it. I mean, and if they want to ask more, they can. So I think it's just kind of feeling comfortable in doing that. And some people, and women too, it's normal. Like some people are wanting to explain or please people. You don't have to do that. I'm giving you permission. You don't have to do that.
Yeah.
One,
And I mean, I think about real quick, Todd, I think about these things that I've heard before of, oh, but she doesn't look sick, or, oh, she takes a lot of naps on the weekends. What are her kids doing? Her poor partner. It's kind of really demystifying that she needs the rest. And yeah, I love that boundary.
Yeah, I will tell you, a dear friend and patient of mine who was on the Everyday Room podcast, she
Mm.
talks about how when she was in law school and she was a practicing attorney in her early 20s in New York. She was running like 5 miles a day, like really athletic, really healthy, and she developed an autoimmune disease. And she was like, I was practically crawling
Oh,
across the street to get to the Duane Reade because I was just like, it's crippling fatigue. But
yeah,
she looks, again, it's like she looks okay on the outside, and it's like the worst feeling and like the most unvalidating what to hear that as a patient.
yeah.
Yeah.
I think all these messages that you're sharing also goes to something else,
Mhm.
which is when, and again, I'm speaking from my mom's experience.
Mhm.
So this could apply whether it's a mom who's 84 years old or a woman who's 34 years old.
Mhm.
So there are people in her life who have disappeared. And it's a very interesting topic
Mm-hmm.
because it's why have they disappeared? And she always wonders. They were here and they're gone. I got sick, and she, as she got very sick, and then they just disappeared. They stopped calling or whatever. So part is my belief, and I'm curious on your opinion on this, is that it has to do on some level with their own mortality, especially with the older
Mhm.
age. And there's,
Mhm.
wait a second, maybe that's me. But perhaps that also applies to a younger age. A 34-year-old is thinking, oh my God, wait, could that be me next?
Interesting.
I think sometimes people don't know how to be.
Yeah, I was
And
just thinking
and
that.
they just and they're worried about, am I going to say the wrong thing? Am I going to do the wrong thing? I don't know how to support. that person.
Mhm.
And then it just kind of their relationship, they just kind of fade. And it's not like of any ill will. And so that circumstance may exist. And then sometimes, yeah, perhaps your point is right, Todd, that maybe people that are older, it's too stressful to witness someone navigating something that difficult. And they just kind of maybe or they perhaps think that they're too busy and they're too stressed,
Mm,
and I'll just give them space. And maybe
yeah.
it's with a place of love that they just sort of give them space to and presume that they're just busy taking care of their health. And so, there's different circumstances, right?
Yeah, absolutely. That actually leads perfectly into this next question, which is what can those friends do different and what can caregivers overall do that truly helps?
So I think that the worst thing that someone could say is like, what do you need help with? Or like, what can I do for you? Or and it's not, if anyone says that, like, no, it's not because you're a bad person. And no one will be mad. It's just, I think on the receiving end, it's like, well, sometimes people that are women, they're navigating through this, they're so overwhelmed. They have so much decision fatigue that they
Mm,
feel like that you're putting something else on their plate. Oh, I have to like find something for you to like help me. And so I think that things can help, is just maybe starting a meal train. I think things that, if you know that it's a bumpy path, just don't ask, just do
mhm.
sometimes. And so
Yeah.
the meal train option is like incredibly, incredibly thoughtful. People are touched when that doing something like that, and it kind of other people can come together. They might want to help, but they don't know what to
Right.
help. And so I think that that can be valuable. And I think just sort of finding ways, things that day to day, knowing that person if they have arthritis, things that, bringing food again, or just sometimes just being there and listening. And you don't always have to be doing something, but I think sometimes that just people that are navigating through that difficult journey with rheumatic disease, knowing that they're not alone. I think just feeling not alone is really, really important. And even just bring a card and a plant, or just like a thoughtful note of kindness, and we're here for you, you're not alone. That really goes a long way. So don't feel like you have to do something over the top in order for it to be valuable.
Yeah. I'll say one thing that you touched on and alluded to is this idea of like validating and acknowledging
Mhm.
what someone's going through and saying things like
Mhm.
something like, this is probably really hard for you.
Mhm.
I can't imagine this is probably really hard. I think that a lot of times we don't want to say that because it sounds like we're not, but I think the validation of that, like, yeah, this is really
Yeah,
hard.
I think one of the best things to hear is I'm really sorry you're going through this.
Yeah.
Something similar. It's just saying it, and it's such a simple statement, but it is so impactful for that individual. And it's not pity at all.
No.
It's simply acknowledging the gravity of what somebody might be going
Yep.
through. Because I think that to kind of go along and be like, oh, to be always kind of chipper and positive and like that's nice, like we love like good vibes, but I think that that is really something important.
This has all kind of been blended with this final topic, which is empowerment and hope.
Mhm.
Uh, there's, it can be challenging to find, to feel empowered and to feel hope. So, what gives you hope when you're treating a newly diagnosed patient?
Well, I think that obviously, like with rheumatic diseases, there are a lot of tools that we have to treat, and I think I think it's important to let people know, when they have diseases where we have a lot of treatments for this. This is treatable. It's not curable, but it's treatable. And just to know that and to emphasize that, I think it's important, and just to kind of help them understand what maybe that first year looks like, and to let them know that you are supported, you're not alone. And even if you need to, one needs to be on these medications, immune drugs or biologic drugs, is to know that most people do still have meaningful, productive lives, and that you will find ways to have new normals. You will adjust. And I do believe, I sincerely believe, I think humans are really resilient, even if beyond what one is believes that they're able to do or can do. I think when faced with tremendous challenge as having a chronic rheumatic disease, I think that you really kind of you really do dig deep and are able to really find those supports.
Yeah, there's a lot of lifestyle changes that help,
Mm-hmm.
from sleep to stress management to movement and nutrition. And how do you get that across to them? Because it's a big change. It's a lot.
It's a lot. Well, and I think that it's not intended to be all at once, right? Like it's just recognizing, just get on the right path, and it's okay. It's normal not to know. You're like making the path as you go along. Sometimes it feels that way, but to know that like it's a process of learning how to be. And it can
Mm,
sometimes, it takes like a marathon, it takes time and maybe over a number of years to really settle in and to be like, okay, I think I kind of got this, and I'm like understanding myself, and like, I have insight about my health and what works for me, and to truly understand that, and just and to know that like who can support you, and that there are systems, and that you never have to feel alone.
mm, yeah.
Yeah, and that mental health component's so important that
Mhm.
they don't have to feel alone, and it's okay to reach out. They'll get some from you because you're compassionate and empathetic, but they may need somebody separate to speak with.
Absolutely. Yeah, I do think that, there are most of my patients have some level of like anxiety and or depression at some point in their disease course. And I think that, I saw a lady a few weeks ago, for example, that had a tremendous amount of anxiety that I think was
Mm,
kind of tied into a lot of her physical symptoms. And I think that in those instances, although as a rheumatologist, I do prescribe anti-anxiety or antidepressants in people that I take care of, I think there are definitely circumstances where I really would like you to have additional support. I think having
mm.
like a therapist, I think is valuable. I think having a psychiatrist can be valuable. So just kind of making sure that mental health puzzle piece is always, always prioritized. I cannot emphasize enough.
Katie, you want to?
Yeah, I do. Bring us home.
Yeah.
I'd like to just ask one final kind of question for our audience and followers, and then Todd, I'll turn it over to you to close it up and share kind of our next episode sequence. If you could share one thing to women that are newly diagnosed today, what would it be?
I think that you are not alone. Um, I think that it is hard always knowing that, but trust yourself, know your body, know your symptoms, and be your best advocate.
Great.
That's great. Well, as always, thank you, Dr. Koolaee. Thank you, Katie. It's always a wonderful conversation because it provides a lot of really important knowledge for folks who are going through this. Women go through this and their caregivers, and now I'm losing my voice, but that's okay. I'll finish up. Thank you to the viewers for watching. Please stay tuned for upcoming episodes in this series and our other My Care Friends series. And we'll look forward to seeing you again soon. Take care.
Thank you.
Bye.
Bye.
Bye.